name is Honorine Ishimwe and I'm a student at Southern New Hampshire University. Today I'm going to talk about healthcare quality in developing countries. I'll be answering these 4 questions. The first question says, how does the status of healthcare quality look like in developing countries? The second one says, what are the different risks that patients are experiencing due to lack of quality of care? The third one says, what are the priorities areas that need much emphasis in terms of quality of care? And the last one, which is the fourth one, says, what are different interventions the stakeholders of healthcare industry should take into consideration for remediation? First of all, let me define healthcare quality. Healthcare quality is defined as the degree to which healthcare services for an individual or population increase the likelihood of desired healthcare outcomes and are consistent with current professional knowledge. So, talking about the first question, which says, how does the status of healthcare quality look like in developing countries? I would say the status is not quite good. The quality of healthcare services in developing countries is not quite good. Even though it's developing, the quality is developing, but it is not good yet. Let me first give you my first point. My first point says, we all see in developing countries, let's say Africa or some countries in Africa, when they want to have healthcare services that they need, they always want to travel. To travel, they say, let me travel to India to get the healthcare services that I need. Let me travel to America, United States of America, to get the healthcare services that they need. This is one first indicator that shows that healthcare quality in developing countries is still low, because they go, even though the countries are still trying to improve the quality, but the quality is not there yet. Another point is, say, there is unsafe medical care. There are many medical errors. There are many adverse drug events. There is no patient safety. This is because the quality of care is not high enough. According to the research I made, 10% of hospitalized patients are expected to get an infection during their stay. This is giving an example. If you're in developing countries, many people, if they're hospitalized, they might even meet with issues like getting those infections that are infectious. For example, getting something like flu because of lack of hygiene. A patient might use the toilet, and then another patient, when he's using the toilet and he touches where the other patient touches, or because of there is not much hygiene, then the patient also gets the infectious disease. There are also medical providers. In developing countries, the medical providers are not enough yet. They're not enough. The healthcare medical providers, the doctors and the nurses, the allied healthcare providers, they're still not enough to provide the healthcare that is needed by the people of the population. There is also no resources. In developing countries, there are few resources, there are few materials, there are few financial resources, there are few resources that can help in giving the quality of care that the population needs. Also, let's talk about the public and private sector in healthcare. When you say there is a difference between public and private healthcare centers. When you go to public is where the healthcare is affordable, of course, but there are many patients, and there are the few healthcare providers, and you see that in public, it's some public healthcare centers, the healthcare quality is not that enough, because there are many. Let me talk about my country, which is Rwanda. You find that the patients are complaining of the long queues, to meet the patient and the provider, and then when they meet the provider, there are they spend less time with the providers, with the doctors or the nurses, because the doctors cannot afford to spend the much time. Of course, there is not enough time for a doctor to spend with their patient, but at least the average time. You see that in public health centers, the patient cannot pass enough time with the doctor or the provider, and that is why the provider ends up giving um, few few medical services. In the whereas in the private sector, in the private medical centers, the healthcare the healthcare the healthcare services are much better, and their quality is much better than in the public um, in public healthcare centers. But the problem is the private healthcare centers can be afforded by few people in developing countries, which means that almost the maximum or the more people they go to public healthcare centers, which they end up having the services that they can, because of few providers and few resources. And also there is overuse, misuse and underuse of resources. Giving an example of this, when we say overuse of resources, we say public healthcare centers. You see, in developing countries, they've made the healthcare as a business. And you see, if you're going to a private healthcare center, you're going to get tests or tested with many medical tests that are not needed, and which may even give you time to be with the doctor, but you're getting the tests that are not needed. That is overuse of resources, and also misuse of resources. Of course, when you're getting the tests and or given or given the medical services that are not needed, you end up uh, misusing the resources. And also underuse, we say underuse mostly in public, because in public, if you're sick, if you say and if you go to the hospital and you give your symptoms, and maybe the doctor just guess it's malaria, he immediately asks you to take a test of malaria on, and maybe might even have blood infections or anything else, but because the doctor has no time to spend with you and has many patients that he has to treat. So that is another point of the low quality of healthcare services in developing countries. And you can also say the education. The education in developing countries is not that high like in the developed countries. That is why you can see that the quality of healthcare in the developing countries is still low. Let's go to the second question. What are the different risks that patients are experiencing due to the lack of quality of care? First of all, patients are experiencing medical errors when they are being treated and they are being treated in a bad way, or adverse drug events. This is where a doctor gives a patient a drug, and then which provides harm to the patient. And also the patients are having some side effects, many side effects of the healthcare services that they are getting because of lack of quality of care. The patients also are acquiring infectious diseases or other diseases that are caused by low quality care. Let's go to the third question, which is, what are the priority areas that need much emphasis in terms of quality of care? Let's first say education. Education, the education of medical education should be emphasized. It should go deeper so that the providers, the specialists or healthcare providers might have the education they need. Might have the education that they need to provide the healthcare services. Let's say providers. Providers are are not enough. The providers needs to be many. The providers needs to be many, to acquire all the patients that in developing countries. Giving an example, as I said, in Rwanda, you can see that in rural areas there are few healthcare providers, and you see that if you live in rural areas and you want to get a surgery or you want to meet with a specialist, you have to travel to the city, to the Kigali, to Ika, to King Faisal Hospital, to Kanombe, just to get the healthcare services that you need. That is because of few providers. So the areas that are needed is the education given to the medical providers, and then it should be deepened, and then the providers should be increased, and then the resources. There are many resources that are needed, especially financial resources and even material resources. Developing countries still need materials that are going to help them to to give the services better. Going to the last question, which is what are the different interventions the stakeholders of healthcare industry should take into consideration for remediation? The first one is reducing education money for healthcare providers. Giving an example, in Rwanda, medicine is the second. It is the second expensive course in Rwanda in taking in the university. So if maybe they reduce the money and they give even more scholarships, there will be more people or more students who can afford going to medicine school. Also, the government should invest their money in healthcare industries, in healthcare industry, in healthcare industry. The government should invest their money in healthcare industry to provide more resources, to buy more medicines, to buy more materials that are needed to treat the patient, and also to build more healthcare facilities, because there are few healthcare facilities in developing countries. Also, the trainings to existing healthcare providers. The existing healthcare providers does not have the knowledge that is needed. Some, not all of them. Some do have the knowledge that is needed. Some they have few knowledge of healthcare, but they need to be trained about how to treat the patient well, and many other things of improving healthcare quality. How they can improve healthcare quality. And the last one would be motivating healthcare providers. You can see a healthcare provider who's very talented and who knows many things, but you can see when he's not maybe appreciating his job or the salary. So healthcare providers should be motivated so that they can produce healthcare. They can produce more healthcare services that are of good quality. Thank you.